everyone. I am Melissa Rambuanga, the Conference Chair of akoparasabata 2021. I am your pre-webinar host, sharing updates, reminders, and announcements. Akoparasabata is celebrating 13 years with this theme, Reimagining the Future, Breaking Barriers, Bridging Gaps. The series of webinars will describe the impact of the COVID-19 pandemic on children and on the practice of child protection 1 year into this challenging time. Discuss the different adaptations in child protection during the pandemic and how we can transition to its future practice. And discuss strategies to strengthen resilience of child protection frontliners, parents, adolescents, and children. Akoparasabata is presented by the Child Protection Network Foundation and UNICEF. We know that providing continuing knowledge to professionals caring and advocating for children is essential, most especially during this difficult time, when it is even more important that services and advocacy remain unhampered. Before we officially start webinar 6, we request everyone to stand up from wherever you are, stretch a bit, baka po mapulikat, and follow the steps to the akoparasabata 2021 Dance Challenge. So I'll demonstrate again the basic steps to our call sign. So please follow me. Okay. So ako, tayo, para sa bata. Again, ako, tayo, para sa bata. Okay, let's do it together. Follow the video on screen. Okay. Thank you so much for participating. Now, may I turn you over to the chair of akoparasabata Webinar 6. Okay, ladies and gentlemen, let us all welcome the head of the section of Developmental and Behavioral Pediatrics in the Medical City and an assistant head of the Child Protection Unit at the Philippine General Hospital, the chair of Webinar 6, Dr. Stella G. Manalo, FPPS, FP, SDVP, and MBAH. On to you, Ma'am Stella.
Thank you, Mel. Good morning, everyone. Magandang umaga talaga ngayon. The sun is shining here in Manila. Sana dun sa lugar nyo, maganda rin ang panahon. So welcome to Webinar 6 of akoparasabata 2021, entitled Lessons Learned from COVID, Strengthening Individual and Organizational Resiliency. I have as co-chair Dr. Isa Quilendrino, and Dr. Isa will be looking through the chat box and the questions, and she'll be fielding the questions later to our speakers in the Q&A section. So we organized this webinar for individuals and organizations to reflect on our resiliency individually and as an organization. It's been 19 months na, since we experienced lockdown due to the COVID pandemic. Hopefully, we are seeing the end of this pandemic. Medyo we can see the light at the end of the tunnel. So in these 19 months, we all have been forced to adapt in different ways to this situation. At ito ang tinatawag na resilience. Are we all okay? Maybe we think we are. So how do we really know if we are coping? Many of us think that we can do it alone. But should we be really doing it alone or with our families? So I did an informal survey in our organization sa CPU-PGH, and you know that PGH is a COVID referral center, and I'm sure many of the participants here are also working in COVID referral centers. So I asked each staff, the doctors, nurses, social workers, and admin people what their greatest challenge was, and the response was similar. the fear of getting COVID, of getting infected, or their family members getting infected. And actually, many have had COVID or had family members getting very sick or dying from it. So it's very traumatic to get COVID. And even if we know in our mind that um, may natural immunity na tayo or na-vaccinate na tayo, there is still this overwhelming and paralyzing fear. So how do we move forward? So I'm sure all of you who are members of various CPUs all over the Philippines have experienced what we went through in CPU. So you can learn from our experience during this pandemic. We have two excellent speakers. The first speaker will tell us what individual and organizational resiliency is, and the second speaker will show us an example of what our organization did to adapt and how it helped its workers during this pandemic. Ang tanong, did we do enough, and what more do we have to do? So let's find the answers to these questions I've posted by listening to the webinar. So aside from our esteemed resource persons, we also have a guest moderator. We're really so fortunate to have this professional and multi-awarded journalist and television host for the second time in our conference series. So she is an assistant professor at the University of the Philippines College of Mass Communications and founder of Project Malasakit Foundation, an NGO for child laborers and indigenous people and communities. So let's give a warm welcome to Cara Patria David. Over to you, Cara.
Hi, Doc Stella. Good morning.
Good morning.
Wow, good morning sa inyong lahat. Nako, isang maganda at makabatang araw sa inyong lahat. Welcome sa ating webinar 6 of Akoparasabata 2021, Lessons Learned from COVID, Strengthening Individual and Organizational Resiliency. Alam nyo, nung inimbitahan ako para mag-host dito sa event na ito, ang una kong tinanong sa sarili ko, shucks, meron nga ba talagang matututuhan sa COVID? Kasi lessons learned from COVID, di ba? Ang daling mawalan ng pag-asa, aminin natin, di ba? Ang daling nating mawalan ng pag-asa sa gitna ng pandemya. Pero, alam niyo po, kwento ko lang ha, kapag nakakakita ako ng mga tao na lumalaban pa rin sa gitna ng kalungkutan, sa gitna ng kanilang trauma, na-inspire ako. Tapos in a way, tumatatag din ako. At yan ang ma-expect ninyo ngayong umaga. Pag-uusapan natin yan ngayong umaga. Pag-uusapan natin yung ating mga pinagdaraan ng lungkot at problema. Bakit? Kasi nagiging mas matatag tayo kapag pinag-uusapan natin ito at kapag nare-realize natin na hindi pala tayo nag-iisa. So, naku, maraming salamat po sa inyong lahat, sa inyong suporta para sa bata. We are full in capacity sa ating Zoom room. 1,000. Nako, talagang todong-todo po talaga yung mga nasa Zoom room natin. Tapos on Facebook, 1,500 ang ating viewers. And I'm very sure na mamaya posibleng madagdagan pa yan. At kapag shinare po ninyo yung link dito sa ating webinar na ito, nako, dadami pa yung ating viewers. Mas maganda kapag marami pong makikinig, maraming makikipagtalakayan. Kasi 'di ba, strength in numbers, kapag mas marami tayo, mas tumatatag din tayo. So sa ngalan po ng Child Protection Network Foundation at ng UNICEF, kami po ay lubos na nagpapasalamat sa inyong lahat sa patuloy ninyong pagsuporta. I will try to make your morning very fun, hindi po boring, entertaining. Siyempre, pag-uusapan natin mga mental health problems minsan, depression, pero pagdating sa dulo, meron ding inspiration. Muli, ako po si Cara Patria David. Ako, tayo, para sa bata. At gaya nga ng aking nabanggit, ang title ng ating webinar ngayong umaga, Lessons Learned from COVID, Strengthening Individual and Organizational Resiliency. Tanong ko lang po sa inyo kapag nababanggit yung salitang resilient, ano ang unang pumapasok sa inyong isipan? Kung ako ang tatanungin, ang unang pumapasok sa aking isipan, no joke po to Pilipino. Very resilient tayong mga Pilipino di ba? Palaging sinasabi that the Filipinos are resilient people. Likas daw sa ating mga Pilipino ang pagiging matatag. In fact, ito yung mga images na pumapasok sa utak ko. Pag may mga bagyo o kaya trahedya, nakakayanan pa ng mga Pilipino nang ngumiti at humanap ng pag-asa sa gitna ng problema, di ba? Pero sa totoo lang, hindi naman sa lahat ng pagkakataon, gaano man ka-resilient tayong mga Pilipino, natural na aapektuhan at nakakaranas din tayo ng kalungkutan, di ba? Lalo na ngayong pandemya, madalas mapapabuntong hininga ka na lang sa dami ng problema, di ba? Yan ang pag-uusapan natin sa webinar na ito, resilience. Not only on the individual level, but on an organizational level as well. Napaka-fragile ng ating mental health situation sa panahon ngayon, pero paano nga ba ito tinutugunan ng mga organizations? So yan yung una nating objective. 'Di ba? Paano nga ba tinutugunan ng mga organizations yung pag-cope dito sa pandemyang ito? Pangalawa, tatalakayin din natin ang iba't ibang mga concepts na kaakibat ng resilience. Okay? So, iintindihin natin itong mga konseptong ito. At ikatlo, ano-ano nga ba ang mga pwede nating gawin para maging mas matatag tayo sa gitna ng pandemya? Mas maging resilient tayo at mas magkaroon tayo ng kakayahan na harapin ang mga problemang ito. So yan yung ating tatlong learning outcomes sa webinar na ito. At gaya ng nabanggit kanina ni Dr. Stella, sinusubok tayo ngayon ng pandemya at marami sa mga bagay na ating nararanasan nakadepende sa ating trabaho, sa ating community, sa ating personal life, konektado ang lahat ng ito. Pero if there's one very important thing that we should all remember, ano man ang inyong pinagdaraanan, hindi ka nag-iisa. Marami ang tulad mo at maraming tao ang pwedeng tumulong sa iyo. So this is a 1.5-hour session. Ayan, nakikita nyo po sa inyong screens ang ating schedule para sa umagang ito. Meron tayong 2 resource persons. Tapos pagkatapos niyan, meron tayong question and answer portion pagkatapos ng kanilang mga presentation. Okay, simulan na natin ang ating webinar na pinamagatang Lessons Learned from COVID, Strengthening Individual and Organizational Resiliency. Okay, bago ko i-introduce yung ating unang speaker, alam niyo po, kwento lang ha, may nabasa akong isang study sa Amerika. Ang sabi, simula daw nang mangyari yung COVID-19 pandemic, halos dumoble ang prevalence ng anxiety and depression sa maraming iba't ibang bansa sa mundo. Tapos, ang pinaka-apektado daw ng mga mental health problems na ito, sadly, ay ang ating mga bayani, yung ating mga frontliners, mga doctors, nurses, social workers, health workers. In fact, sa Amerika nga raw, if I'm not mistaken, 62% ng frontliners doon experienced anxiety, depression, and different mental health issues. So, paano nga ba natin mapapangalagaan ang ating mental health sa panahon ng pandemya? Okay, maswerte tayo kasi para pag-usapan ng cultivating resilience during the pandemic, ang una nating speaker ay isang full-time professor, licensed psychologist at chief of party ng USAID Renew Health Project. Dati siyang chairperson ng Department of Psychology ng Ateneo de Manila University. At dati rin siyang presidente ng Psychological Association of the Philippines. She is a prolific researcher named one of the outstanding young scientists in 2005. At active din po siya sa mga outreach, making sure that mental health services are provided for those who need it most. So, hindi lang siya sa academe, talagang lumalabas din siya talaga on field. For her efforts, she was named Outstanding Women in the Nation's Service in 2010 and in 2018, Outstanding Professional in Psychology by the Professional Regulatory Commission. Ngayong taon po, she was awarded the Global Citizenship Citation by the American Psychological Association International Psychology Division for her work in community mental health. Ang gusto ko po dito sa ating susunod na speaker, kasi talagang she puts her words into action. Yung hindi lang yung kanyang mga napag-aralan, ay hindi lang kumbaga nililimit niya sa loob ng eskwelahan o sa loob ng kanyang opisina. Talagang lumalabas siya talaga doon sa mga communities. To discuss cultivating resilience, maximizing adaptive capacity during the pandemic and beyond, palakpakan po natin, virtual clap, Dr. Maria Regina Alampay Hetchanova. Magandang umaga sa iyo, Doc Gina.
Hi, hello everyone, and thank you, Cara. Yan si Cara, kabatch ko yan sa Towns 2010, kaya matagal-tagal na rin po kami magkakilala. Papasalamat din ako kay Dr. Stella, Dr. Bernie for the invitation. Ayan, meron mga nagsha-shoutout sa akin. Mukhang may mga estudyante ako na nandito ngayon. So hello sa inyong lahat. So I was asked to talk about how do we ensure the mental health of workers. At pag sinabing mental health of workers, kasama kayo dyan. Dahil whether you are a social worker or a frontliner, a health worker, or an LGU frontliner, all of us have been affected. So what will I talk about today? Tulad nga nung sinabi ni Cara, meron mga pag-aaral sa ibang bansa. Sino ba talaga yung naapektuhan ng COVID? And I'd like to share with you our own studies on who has been affected by the COVID in the Philippines. And then I'd like also to talk about the link between mental health and resilience, and also what we can do, whether it's in our organization or for ourselves or other people. How can we help build resilience? Okay? So as I talk, please feel free also to write down your questions on the chat box, and we will try to get to them later on. All right, here we go. Tulad nga ng sinabi namin, we always say, parang your emotions are your emotions. There's no right and wrong emotion. If you feel what you feel, and that's okay. It's okay even if you're not okay. And that's one message that I keep telling people, because it's a pandemic, right? So it's not a normal situation, and it's even more abnormal by the fact that it's been going on for so long. I wanted to share with you a study that we did last year on how Filipinos are. And tulad nga no sabi ni Cara na parang may study sa ibang bansa na parang dumudoble yung anxiety and depression. Makikita ninyo yung red, parang the darkest bar are those with extreme stress, anxiety, and depression. So, ano napapansin niyo of these three emotions, stress, anxiety, and depression, saan pinakamadami ang severe and extreme? Anxiety. Tama. Oo. And naturally so, kasi nga, we are caught in a situation where there's a lot of unknowns. There is a lot of things we do not know. We don't know when everybody will be vaccinated. We don't know when we might get infected. So there are so many unknowns, right? And kanina nabanggit ni Cara, parang the studies are saying health workers. Sa aming study naman, sino yung at risk? Two groups. One is BATA, the 25-year-old and below, and the women, okay? And there are actually very good explanations for why. Youth, why? Because we know that our brain development does not mature, our brain does not mature fully until the mid-20s. And so from then, from adolescent to the mid-20s, you have a lot of emotions. So your hormones are fluctuating, you have a lot of feels, but your brain cognitively may not have the capacity to handle them rationally. And so there's a lot of emotion, but the ability to adjust to all of these emotions or manage these emotions are not necessarily there. And the truth is, we don't learn this in school, right? Parang there's no class on resilience in school. And so we may not know how to adjust. And women, there's also a lot of studies that women compared to men have a higher degree of mental health illness, or are more anxious or more depressed. This has to do with physiological. Maybe we are just more emotionally sensitive, not just to ourselves, but others as well. And so that may make one reason why mas mataas yung risk. And I wanted to link it to healthcare workers, kasi karamihan ng healthcare worker natin ay babae, right? And so that might also explain why mas mataas generally in studies ang mental health outcome nitong pandemic, especially among women. All right. So now we know what is the mental health outcome. Let's talk about what affects those outcomes. In our study, we asked people what stresses you, okay? And obviously, there's a part of the stressors that are health related. So being exposed to COVID, getting sick from COVID. And early on, especially when we began the lockdown, the access to basic needs, especially if you're in quarantine and you don't know how to access your basic needs, there are many people who have lost their jobs or lost their incomes or diminished their incomes. And that's very difficult, especially if you're a breadwinner. For others, the increase or change in this work from home setting, akala natin mas madali ang work from home, pero mas nakakapagod siya, especially for the women or the moms who are also juggling, helping their kids learn, no? And then finally, there are social stressors, the lack of social support, especially since we don't have the regular, face-to-face encounters, meetups with families and friends that are our source of resilience. Right now, we're also hearing stress because of discord in the family kasi hindi tayo sanay na nasa enclosed space tayo lahat 24/7 in each other's spaces. So nagkakasungita, nagkakabugnutan because people are stressed. And then, of course, another source of COVID stress is the news. No? So especially the bad news about deaths, or whether it's in social media. Minsan, I hear people saying, ayoko muna mag-Facebook kasi nakaka-depress, puro deaths yung nakikita ko, or puro problema yung nakikita ko. Tanong ko lang, pop quiz. Tingin nyo, alin dito yung pinaka-predictive of stress? Any guesses? Sabi ng iba, news. Sabi ng iba, social, lost income. Sige. So babanggitin ko na sa study namin, we did what we call regression analysis just to see alin ba dito yung pinaka-predictive of stress. Ang sagot? Social support, the lack of social support, no? Surprising, no? Akala natin it's the health issue, but it's actually the lack of social support. Bakit? Siguro kasi lahat naramdaman ito. Unlike others na hindi nararamdaman yung iba. And maybe it's also cultural kasi nga our identity as Filipinos is very, interpersonal. No? We have a social identity that's not just our own, but as a product of who we are. So when we lose those social interactions, especially the youth, I think, nahirapan sila kasi learning is social. And so without their friends there, learning isn't as fun perhaps, or it isn't as meaningful because they've lost that sense of social support. So ang tanong, many of these wala tayong magagawa, no? They're actually outside our control. But what is it that is within our control? What our study found is between stressors and mental health outcomes is resilience. So ano nga ba itong resilience? Kanina sabi ni Cara, ang Filipino resilient. Ano nga ba ibig sabihin ng resilient, right? We used to define resilience as the ability to bounce back. But, in this day and age, what is back? Baka hindi na nga back, di ba? But right now, we really look at it as the ability to withstand and to thrive amidst difficult situations. So ang Filipino nga ba naturally resilient? I've always been asked, is it something that innate? So, taos ba sa Pilipino ang pagiging resilience? Or is it something that is developed? Okay? So, it's both. There is a component of resilience that is inherent. So, more personality. Meron mga tao na personality-wise, mas tough talaga. Emotionally stable siya. Hindi siya kasing nararatel. Hindi siya masyado nasi-stress. Okay? Swertihan na lang yon. But resilience also is a product of our environment. So we look at it from an ecological perspective. Ano ibig sabihin nito? Your resilience comes from the support you get from your family, the support you get from your community. So ang tanong, ang Pilipino ba resilient talaga by nature, or is it because kapag may nangyari sa atin, nagtutulungan tayo nagtutulungan yung pamilya, nagtutulungan yung community. And maybe that's where the resilience is coming from. Resilience is also a product of the experience of challenging situations. Maybe kaya mas mataas ang resilience ng matatanda kaysa sa bata kasi mas marami talaga siyang napagdaanan na pagsusubok at mas tumatag siya because of those trials. And so sometimes I tell parents, when I ask to talk to parents, I also tell them, it's also not good for you to want your child to have a very easy life because you're not building their resilience. It's not good for them not to experience failure or hardship because it's through failure and hardship that they are also able to strengthen their sense of resilience, right? So if there's anything that I want you to remember, that resilience is not just personal, it's also a product of the environment. And so if it's a product of the environment, what can we do? No? So if it's a holistic, if it's an ecological phenomenon, what can we do to build resilience? So from an individual perspective, I said kanina na parang resilience can be a function of personality trait, right? But what we're also seeing that it's also a function of behavior, which means that even if you're not internally, personality-wise, you may not be resilient. There are behaviors you can do to become resilient. For example, next slide, please. In our study, we found that there are certain things during this pandemic that appear to be more helpful than others. So, yan. Pop quiz muna ulit. Sige nga, anong mga ginagawa ninyo to cope during this pandemic? Let's take a look at what you have been doing and let's look at which might be helpful. So, alin dito yung nakatulong sa inyo? Yan. So, meron na ako nakikita sa chat box, things like prayer, talk to friends, listen to music. Yan, mga naging plantito, plantita, nagtanim. O, ang daming plantito dito, ha? Yan, prayer, online gaming, drinking coffee, cycling, exercise, Netflix, cooking. Ayan. Always duty. Hala, work ang naging coping. All right. Spending time with my daughter. Pets, tama yan. Oo. Biking, exercise, eating. Ayan, ang dami kayang tumaba nitong pandemic. Okay. Exercise, music, prayer, sleeping, Netflix. Okay, so actually lahat naman yan okay, di ba? But I also wanted to share with you our study on alin yung parang behaviors that appear to be more helpful than others, okay? So here we took a look at, we did a study on coping behaviors and we regressed them into to depression, anxiety, and stress are outcome variable. Okay. Coping strategies appeared to be related to diminished depression, anxiety, and stress. Okay. These are problem solving and perspective taking and spiritual coping. Okay. So problem solving and perspective taking is thinking about what I can do to solve my problem. And perspective taking might also be looking at your problem in a different way. So trying to look at maybe the positive in the situation rather than problematizing it. So halimbawa sa estudyante that hate online learning, right? So you can look at online learning as I'm not learning anything, or you can look at online learning as at least I'm learning something than nothing at all. Or you can look at it as everybody is in the same boat anyway. So let's make the most out of it. So it really is how we view a stressor is really dependent on how we look at a stressor will determine whether we are stressed by it or not. So we can look at a situation as, yung half empty or half full, and that will determine how stressed we are. Spiritual support, so spiritual coping, ayan, may nagsasabi, attending to mass, prayer, Bible reading. Apparently, people who do this more also report less depression and anxiety. Gusto ko ding i-note na medyo may correlation sa age to ha. Medyo mas madaming positive yung correlation ng spiritual coping in age. So mas ginagawa ito ng may edad, which might also explain why mas mababa yung depression, anxiety, and stress ng older individuals. Now, notice these other ones, distraction. And distraction there can be watching TV or even plants, etc. Okay, so anything that you do to recreate. Denial, okay, and substance use. Mas maraming umiinom or nagsusmoke pang stress release because of the pandemic. But notice na yung arrow, meaning habang mas ginagawa siya, people who reported increased use of this also reported increased depression, anxiety, and stress. Okay. So what does that mean? Hindi naman sa sinasabi natin na hindi talaga siya useful, pero baka naman it's also the balance. Baka naman if we're using too much distraction and not enough of the other things, that might not really be helpful, because maybe the distraction is just a way to deny that we are actually feeling stressed. So to me, the message here is that yes, we have our own ways of coping, but there are some ways of coping that might be more helpful than others. So if we know this, we know who are at risk, we know what stresses people, we know what behaviors might be more helpful than others, what can we do to help ourselves or other people become more resilient? So this is parang a mental health pyramid that we use for disasters. And here, as you can see, the first priority is basic needs, right? So even before looking at the psychological needs of a person, we need to make sure that they're okay. Mahirap maging matatag yung gutom at may sakit, di ba? So dun muna tayo kung yun yung need nila. I remember a month ago, my entire family had COVID. And so lahat kami naka-quarantine. So anong problema ko? Ang problema ko, basic needs. Kasi paano namin makukuha yung food, medicine, and etc. And that was where family and community support was very important, because sila yung tumutulong in getting the basic needs that my family really needed. And then of course, after you've met basic needs, self-care. Kasi hindi naman lahat kailangan clinical help or may clinical illness na depression and anxiety. Most people will be able to care for themselves with a little bit of help, with a little bit of information, with a little bit of education on self-care. We might also, if you're in an organization, a part of an organization, there are things that companies can do to care for the employees, wellness programs, benefits, providing psych first aid, training bosses on how to spot people who might need PFA, preventing stigma and discrimination. So we've been hearing about people who have had COVID who've also experienced double. Kumaga, may COVID na nga sila, na-stigmatize at na-discriminate pa sila. And then for those who are experiencing moderate distress, then they may need things like a resilience program, a stress management program, counseling, debriefing, or even just a peer support group. For example, there are companies now or orgs now that are doing peer support groups for those who have lost loved ones, or those who have gotten COVID and are still recuperating from that experience. And then, of course, for those who may need specialized services, then either a referral or even benefits or coverage, subsidizing assistance to seeing a professional if you need to. So that's in a nutshell. And later on, I'll talk a little bit about more details. But I'll begin with self-care, and I'd like to introduce to the body here a mental health app that was just launched last month during the Mental Health Week, and it is by the Department of Health and also created in partnership with the USAID Renew Health Project. So it's the first of its kind. It's a mental health app that allows you to monitor your mood, your well-being, to assess your own coping behaviors. And it also provides access to self-help interventions, like a resilient intervention, or there's another program there called Doing What Matters in Times of Stress. So we've actually tested this mobile app last month in both, schools, communities, healthcare, and in the workplace across the country. And we wanted to find out, nakakatulong ba? Because what we are trying to do is advocate evidence-based interventions. And what we did is we compared people using the app with people using our DOH workbook for those in isolation facilities. And we found that both workbook and Lusog Isip app users improved their well-being in 2 weeks, and their ability to reframe their situation. But there was one advantage of the app that was not available to those who use the workbook, which was the ability to be aware of and release their emotions. So, importante kasi yun di ba? Kanina nakita nyo how denial sometimes is actually counterproductive. Because the first step to being okay is to admitting that you're not okay right now. Because it's only when you admit that you're okay to yourself, then you can actually do something about it. But if you don't think that, if you're not even admitting that, then obviously you can't help yourself. So,
Feeling
this is just a little
stressed?
video
That's normal.
on Lusog Isip.
There may be times that we feel overwhelmed, anxious, or unwell, but there are healthy ways to cope. Introducing Lusog Isip, the first mobile app for self-help on mental health and wellness, culturally adapted for Filipinos. It uses evidence-based tools and interventions to help you help yourself so that you can improve your overall well-being by reminding you daily to look after yourself. Now, you know where to find help when you need it the most. Download the Lusog Isip app now.
Yeah, so it's already available in the Google Play and App Store. So check it out. Baka makatulong sa inyo. And if it does help you, favor na lang. Can you just tell other people about it so that you might also be able to help them? All right. So Lusog Isip is really about self-care. And it's free, ha? Yun ang gusto ko i-emphasize. Wala pong bayad ang pag-download at paggamit ng Lusog Isip. Now, beyond self-care, what can we do? No? What can we do for our organizations or our employees? I'd like to share a little bit about another study that we did, about an intervention that we implemented. It's a resilience intervention that we've been implementing since June of 2020, so almost a year and a half now. It's a 6-module intervention that focuses on 6 resilience skills. Kalakasan, which is acknowledging our strengths. Katawan is how do we manage our physical reactions. Kalooban is how do we manage negative thoughts and emotions. Kapaki-pakinabang gawain is what are some of our routines in our lifestyle choices. Kalutasan and kaagapay is about problem solving and seeking help from others. And kabuluhan at kinabukasan is about trying to make meaning of what we've experienced and what we want to hope for in the future. So what we do here in this program is we just go through each resilience module and talk about it and how it relates to our lives. And it can be as long as about an hour and a half, sometimes 2, depending on how many there are. But we usually try to keep these groups small. So katatagan has been tested, again, in the spirit of evidence-based interventions. So it is now delivered in 3 ways. Through the Psychological Association of the Philippines, right now there are ongoing katatagan groups. So you can sign up to get registered into a group, and Each small group just meets maybe once or twice a week. There's also a Canvas class on Katatagan that you can take on your own time. And now it's part of the Lusog Isip app. And does it work? Well, so far, our findings show that whether it is in a synchronous way, meaning we meet every week at the same time, or is it the asynchronous method, meaning the class itself, so far our trials show improvements in resilience, improvements in well-being, improvements in the ability to not so react so emotionally to whatever is going on, improvements in adaptive coping. And so we were really happy to find that the modalities actually were not as important as the content and the experience of going through it, whether it's with other people or on your own. So that's one. So some companies, some schools are actually now using Katatagan as part of their guidance programs or employee care programs. So that's just one example of a resilience program that can be implemented. But what else, no? And this is my last slide for today. We did a study 2 years ago on what enables organization resilience in the Philippines. And we used the Johns Hopkins model of resistance, resilience, and recovery. Resistance is what your organization can do before a disaster happens. So resistance, kasi it makes you more strong, no? When a disaster comes. But this include putting up communication systems and protocols. So when something happens, employees know whom to call, having a database so that if you need to know in a very quick way who are affected, then there is a way of tracking, okay, who are sick, who are not, and then protocols that are in place. So employees know if I get symptoms of COVID, what do I need to do? Then there are also the organizational aspect. There's a response team so that there's a team in charge who can develop, say, continuity plans, who can determine what kind of resources do we need, what kind of partners do we need. So for example, some companies have partnered with hospitals so that if their employees get sick, they can refer them to these hospitals. Others will have kits, safety equipment, that COVID care kits, for example, that they send their participants or they send their employees. And then, of course, training people on the safety protocols. Now, when a disaster hits, then now we come into the phase of resilience. So this is the activation of the protocols and then assessing the impact. So who are affected and how, providing psychological first aid for those who may have been affected. And of course, sabi natin, basic needs first, provision of material and financial resources to those who are affected. So it might be, some companies have this, pahulugan system where we know that our health insurance will not cover everything, especially if you've been hit hard by COVID. So they have this paluwagan system na kung kailangan mo ng extra funds for COVID-related expenses, you can ask for help from that, or things like that. Or there's a loan facility that can be provided for those who really need assistance. And then, of course, post-disaster is what we call recovery. So this might be access to resilience programs or counseling. For example, those who have lost loved ones, or for example, somebody died among your colleagues. Sometimes there's sort of debriefing that happens after that. And then the review of protocols and the restoration of facilities. So these are just examples of what organizations can do to help their employees or their members become more resilient. I think that's the end of my presentation. Tama ba? Sige. And I will be happy to answer your questions. Unless, Cara, you have a question for me.
Ako, ang dami kong tanong. Thanks, Doc Gina. Ang dami kong natutuhan actually. Ang pinakatumatak sa akin yung tama po kayo na yung resilience is a product not only of challenging situations, pero yung level ng social support that we get na alam mo na kapag marami kang kaagapay, alam mo kapag marami kang masasandalan, medyo tumataas din yung resilience mo, no?
Yeah. Ako, very near kasi yung experience sa akin kasi last month lang kami lahat nagka-COVID. So, alam mo yun, minsan just the PNM ka, are you okay? Is there anything you need? Kahit hindi ko kinuha yung offer niya, just that offer, nakakatatag ng loob.
Totoo yan. Ako, kasi di ba, I'm a TV reporter, tapos kami, mga reporters, kahit nung kasagsagan ng pandemya, lumalabas talaga kami. So, ang taas-taas ng anxiety level namin that we might bring back the disease into our families. So, nung nag-start pa lang yung pandemic, konting kwento lang po, kaming mga reporters, mga kapuso reporters, nag-set up na kami. Kami lang, it's not really the whole company, pero kaming mga reporters, nag-create na kami ng Viber group na sabi namin, just in case someone gets COVID, pwede ba tayong gumawa na ng sistema na everyday may magpapadala ng pagkain doon sa reporter na may sakit. So ako, I got COVID noong September. Ay, Diyos ko. 30 kami na reporters, 30 kami na reporters. Every day, lunch, dinner, may nakatoka.
Busog na busog ka.
Busog na busog ako. Tapos hindi mo pinoproblema yung everyday kasi may nagpapadala. At saka gumagaan yung pasan kapag marami ang pumapasan, di ba? Ang lahat ng bagay ay gumagaan pag marami ang pumapasan. That's what we always tell each other na tayo mga reporters, we know that lahat ng problema ay gumagaan kapag marami tayong papasan. So kapag may isa sa atin na may COVID, toka tayo. Tuesday ikaw, Wednesday ikaw, gano'n. Tapos and sooner or later you realize, ay tapos na yung quarantine ko. Tumaba pa ako. Alam mo? But it really helps. Yung social support really helps.
Correct.
And when you say social support, guys, hindi ibig sabihin nito malaking halaga ng pera. Just a simple snack or I'm praying for you, yung mga ganyan. It really helps.
Yes, I agree.
Pero ako, ang tanong ko, Doc Gina, kasi nga, di ba, laging sinasabi that Filipinos are very resilient. But how do you identify that you really need help? Kasi naniniwala ako na ang unang hakbang sa pagpapanatili ng ating mental health is to recognize that we have a problem. To admit that we have a problem and to admit that we need help. Pero dahil likas na matatag tayong mga Pilipino minsan, marami tayong iniisip na, hindi, wala to. Mood lang to. Mood swings lang yan. O
Correct.
Meron bang telltale signs
naman
na depressed ka na or yung kamag-anak mo ay depressed na and that person really needs help at hindi na dapat baliwalain? Alam ko marami yan, Doc Gina, pero
sige.
Sa background, yung listahan lang ng mga, ano ba ang signs ng depression na, kapag nakikita nyo ito na yung nararanasan ng kamag-anak ninyo, huwag nyo nang baliwalain yan. That person needs help.
Okay. So parang ako, two general things, no? One is changes in the person. So changes in sleep pattern, changes in eating patterns. Kasi it can be mas natutulog or hindi natutulog, mas kumakain or hindi kumakain, right? Changes in moods, na parang hindi naman siya dati bugnutin, pero bugnutin siya ngayon. So parang any change na parang na hindi temporary, hindi yung isang araw lang, pero medyo prolonged siya, na parang 3 linggo na ganun talaga. So that's one, yung parang changes in the patterns of the person. And then the second is functionality. Meaning, kung dati nakakatrabaho siya, hindi na siya nakakatrabaho. Hindi na siya makaaral ng maayos. Parang signs na yon na mukhang may problema.
Pero Gina, minsan may mga iba na kaya pa rin magtrabaho pero I mean, ako personally, I know this because I'm diagnosed bipolar. So, actually, ako, nakakatrabaho pa rin ako. So, hindi naniniwala yung mga tao na nasa depressive state ako ngayon. Yung
Kasi
ganon.
may meds ka.
May
Meron
meds
kang,
Oo.
oo. So sa akin, parang, kasi at least ikaw, alam mo, tapos meron kang help. The problem is if you don't know, right?
Correct.
Ang napapansin din namin dito sa maraming Pilipino is nasosomatize ang mental health. Meaning, nasa denial. So baka hindi mo makita, pero nagkakasakit. So, pag nagiging masakitin ka na, or parating masakit na yung katawan mo, di ba? Meron masakit ang ulo mo, minsan nasosomatize yung symptoms natin.
Correct.
So, those are the signs, no? Nagkakasakit.
Ba, may nabasa ako na pag hindi ka na daw nag-aayos, or hindi ka na naliligo, yung hygiene.
Yun, that's a change, di ba? That's a change. I mean, sabihin your hygiene has been affected as well. So, any major drastic changes, medyo iba-iba kada tao yung pero yes, parang makita mo naman kung nag-iba na siya, na medyo prolonged yung pag-iiba niya.
Oo, at saka yung kunyari, naiiyak ka ng for no reason.
Pwede rin, oo.
That's related actually to the question of, anong tawag nito, to Sister Norma. Norma, sabi niya, how can we help if someone keeps on denying that she has sickness?
Yes, okay. So one is, minsan nasa pagtanong or minsan nasa approach din natin yon, di ba? Kung yung dating natin nako, tingin ko may problema ka, baka naman talagang that will put a person medyo maging mas defensive. So minsan lang di ba, yung kamusta ka? Minsan ganun lang kasimpleng tanong, kamusta ka? Okay ka ba? Meron ka bang gusto mo bang ng kausap? Ganyan. Or minsan, pag tayong Pilipino, minsan magda-drop ka lang ng, alam mo, medyo nasistress ako ngayon. Ikaw, kamusta? Para to make them feel at ease, di ba?
Parang pagpakiramdam nila na, uy, parang hindi lang ako yung nakakaranas nito.
Parang,
mas mag-open up ka.
Oo, so pwede din naman yon. So minsan, lang, medyo disimulado lang yung Pero pwede rin naman, if you're already seeing signs na, kunyari, hindi na siya functional, pwede mong sabihin, alam mo, nag-aalala ako para sa'yo. Kasi nakikita ko, parang hindi ka na natutulog. Okay ka ba? Di ba? So it's coming from you being concerned for that person rather than saying, alam mo, tingin ko may problema ka. Alam mo yun, magkaiba siya, di ba? So it's, alam mo, nag-aalala ako sa'yo kasi parang mapayat ka. Okay ka ba? Ganyan. Ganon. So, or pwede rin na, ito tingnan mo tong app, nakatulong sa akin.
Ano nga ulit yung pangalan ng app? May nagtatanong.
Lusog Isip. Ayan, Lusog Isip.
Ito, may magtatanong, ano daw ulit yung pangalan ng app? It's Lusog Isip. Okay.
Ayan, Lusog Isip.
One last question pa po. Ang daming questions bigla. Sabi ni Cheldy Alodia, paano naman daw po yung mga taong hindi pwedeng magpakita ng weakness kasi nakadepend sa kanila yung buong pamilya nila?
Yung relate ako dyan. Kasi like kami nagka-COVID, syempre, yung husband ko nasa hospital, yung kids ko lahat may sakit. So alangan naman ako, weak ako. Kasi kailangan nila ako maging strong, di ba? So throughout that week, strong ako. Pero on that one time na I had to go out by myself, tumutulong na lang yung luha ko kasi doon ko na lang lalabas. So sa akin, okay lang yun, ilabas nyo kung malalabas nyo kahit nasa banyo kayo, kahit na kung saan kayo. Kasi minsan, kailangan nyo rin din mag-vent, di ba? So, if not to your family because you feel that you don't want them to see you weak, it's okay that you vent to somebody else. Yeah. But, I also think that sometimes, it's actually okay also to show, for example, na at a certain point, ako sinasabi ko sa kids ko, na, ganito na yung dad nyo. Pero pag na-solve na namin yung problema, not in the middle of it, pero pag nung time na yon, sasabihin ko din sa kanila, kasi parang gusto ko din na pwede din sila mag-share sa akin, na ito yung naramdaman ko. So pwede ko sabihin, alam mo, na-stress ako kanina umaga kasi naghahanap kami ng gamot, na wala kami mahanap na gamot. It's actually okay also to be real, because sometimes if people feel that bato ka, hindi ka nila lalapitan kasi bato ka naman eh. Di ba?
Totoo. Totoo.
So yeah,
It's okay not to be okay.
true.
Oo. Ang hindi okay ay yung i-deny that you're not okay.
True.
Naku, ang dami nating tanong, Doc Gina. Guys, I have 7 questions here, pero wait lang po muna. Tatanungin po natin lahat yan mamaya.
Sige.
We have another speaker. Babalik po si Doc Gina mamaya for our Q&A. Ang daming tanong sa inyo dito, Doc Gina.
Okay
In the
lang.
meantime, thank you very much, Doc Gina Hechanova Alampay. Maraming salamat. Sobrang excited na ako sa Q&A. Ang dami ko pang itatanong sa inyo.
Sige po.
Thanks, Doc Gina. Maraming salamat. Before I move on to our next speaker, may nagtatanong lang sa akin dito si Alvini Brioso. Sabi niya, Miss Cara, what are the discriminations or stigma you experienced after you were diagnosed with bipolar condition? How did you get over it or reacted to it? Madali pong magtago at i-deny that you have a mental health condition, pero if you do have it, you approach it this way. You approach it na ibinigay ito sa akin and it's a gift. Ako tinitingnan ko siya as a gift because it's a challenge for me to be stronger. And if I am able to function pa rin even with my mental health condition, if I am able to still do my job and to do a wonderful job living this life, then mas nagiging strong ako. And malaking bagay sa atin yung i-identify natin that we have a problem and that identify that there are people who are able to help us. It will strengthen you. And may kantang ganun, di ba? What doesn't kill you makes you stronger. It will make you stronger. All right. Anyway, guys, tawag nito, mamaya marami pa tayong mga panahon sa Q&A para sagutin yung inyong mga tanong. Nakakatuwa yung presentation kanina ni Doc Gina. Nakita natin na itong COVID, hindi lang talaga problema sa kalusugan yung idinulot, 'di ba? Nandiyan yung mga anxiety, depression, etc. At importante yung trabaho ng ating mga frontliners, medical frontliners, pati yung mga iba pang frontliners natin, mga police, social workers, health workers, mga kawani ng child protection network sa buong bansa. Very, very important din yan. At gaya nga na sinabi ni Dr. Gina kanina, mental health problems can affect all of us, even the frontliners themselves. Kailangan din ng tulong ng mga, kumbaga, kailangan din ng tulong ng mga taong tumutulong. At tulad natin, napapagod din sila, nalulungkot at natatakot. So, ang question ay, ano nga ba ang maaaring gawin ng mga organizations para mapanatiling matatag, resilient yung ating mga frontliners lalo na sa panahon ng pandemya? Para i-discuss ang organizational resilience, supporting the healthcare system and providers in the workplace is the founding director and head of the Child Protection Unit at the Philippine General Hospital and concurrently associate clinical professor of pediatrics. She is the executive director of the Child Protection Network Foundation Incorporated and has published several articles in local and international peer-reviewed journals, chapters in books and manuals, as well as researches on child protection, which had contributed to changes in policy and practice in the Philippines. In recognition of CPN's work in the field of child protection, she has been made the co-chair of the WHO Guideline Development Group for the Response to Sexual Abuse of Children and Adolescents and the WHO Guideline Development Group on Responding to Child Maltreatment. This year, she was awarded by the Philippine Pediatric Society as the most outstanding pediatrician of the year. Let us give a warm welcome to Dr. Bernadette Bernie Madrid. Hi, Bernie.
Hi, salamat, Cara. I was so engrossed sa Q&A nyo ni Gina. I didn't want it to stop. Parang nang sabihin, pwede ba hindi na ako mag-lecture? tuloy na lang natin yung Q&A. It's so interesting.
Ay, nako.
It's so helpful. Talaga. And thank you for sharing your own story, Cara. For me, that is really, straight to the heart.
Alam nyo guys, si Dr. Bernie kahit pediatrician siya, doktor ko pa rin siya. Meron ako mga problema, mga anxiety. Ayan, malapit pa rin ako kay Dr. Bernie. So, pero ngayon ang pag-uusapan na natin, kasi nanggaling na tayo sa individual di ba? So ngayon, organizational naman. Paano nga ba nakapag-cope yung CPU dito sa pandemic na ito? Kasi kahit yung mga taong tumutulong, kailangan din ng tulong.
Yeah,
Oo.
it's really been the most challenging, but the most rewarding also. And yeah, so yes, I hope that people will learn something. Narinig na kasi natin yung anong sinabi ni Professor Gina, and we'd like to use CPU as an example of how we coped, how we became resilient and still working towards it, because it's a work in progress. It's not done during this pandemic. So, okay.
Go ahead. We're all ears.
Sige. See you again in a while. Okay. Okay. So first, what do we mean by organizational resiliency? Kasi kanina, Professor Gina already talked about the individual resiliency and workers' resiliency within an organization. But how about an organization as a whole, as an organization? So it's the ability of that organization to anticipate, prepare for, respond, and adapt to incremental change or sudden disruptions in order to survive and prosper. No? So when we look at organizations, how do organizations build towards this resiliency? Because you cannot just be resilient suddenly when disaster is already there or when you're already faced with COVID. Hindi pwede na dyan ka palang nag-umpisa. So you have to be prepared. So first of all, studies have shown that successful organizations have well-established routines. Yung how you get things done, even just how to buy a computer, how do you hire staff, yung work is predictable for everyone. There are simple rules in how decisions are made. Everyone in the organization understands how decisions are made. So predictable din siya. No, hindi yung sudden change like the weather. Hindi pwedeng ganun. And of course, you have to be creative and know how to improvise then. Not too rigid, because when you are faced with a new challenge, baka you need to rethink how you do things to be able to adjust. Hindi pwede din na masyado kang rigid, hindi ka na flexible. Kasi another sign of a resilient organization is that the ease with teams, which teams refashion how specific tasks get done, whatever the level of turbulence, nakaka-adjust yung mga tao and how they do things. So there are many things, so that needs to be done to prepare. And you will ask, bakit ba natin pinag-uusapan ito? Importante ba yan? Yes, it is. Because pwedeng mawala yung organization mo. Maybe you're there now and then suddenly your organization fails. And then what? Magsasarado ka? So at the times of crisis, and we look at business practices, marami kasi mga business practices that we can learn from. What they have found that it is, as they said, at the times of crisis is also a time of opportunity. That's when you discover what you did not know before because you are forced to. So for example, yung mga restaurants, di ba? Nagsarado dahil nag-lockdown. So how will they survive? So that's why marami na tayo ngayon food delivery. Everybody, has food delivery and do quite well with that. So they found new markets. And also we have to look at ano yung mga strategies that we can adopt dahil sa disruption sa services. So for example, now we have a lot of people working from home. In fact, in some organizations, they found na baka hindi na kailangan ng manager because of the way that people are working now, and people predict that this work from home strategy might even persist post-COVID. No, that it might even create a better work-life balance for some. Although there's some na gusto nila pumunta sa opisina. Must they find that they could work better away from home kasi masyadong magulo sa bahay. But overall, work from home seems to be working. And then during crisis also, resilient organizations do not restrict resources. This is the time to use your savings. Pero dapat may savings ka. So one rule of thumb about savings for organizations is that you should have at least in your emergency savings 1.5 years worth of your budget, no? So that kahit hindi ka nag-fundraising for 1 year, you still have a budget for that 1 year at least, no? And you should use those savings. Again, those that survived in business were those who had savings that they spent during the time of crisis. So that's why you have to prepare for it. You have to be proactive. And when it comes to partnerships, you'll see later in my example of CPU that we have a lot of partners who helped us during COVID. Those partnerships did not just develop during COVID. Those partnerships took years to develop. And partnerships does not mean that you just get money. Hindi ganun. Mayroong counterpart yan, partner eh. So both of you put something in the pot and you've been working together and you know how each other work and you trust each other because you've been doing it for years, not only during the time of the crisis. And high reliability organization demonstrate resilience through effective teamwork. So lahat na employees sa organization should be working together as a team and looking at solutions, working out solutions together as a team. Hindi lang solutions are not just coming from top down, but also bottom up. And we allow, frontliners to make also decisions at their level. Hindi lang lahat dapat galing sa head. Okay, so you have to trust that staff can make good decisions. And last but not least, employees should also have psychological capital. No? So like sinabi kanina ni Professor Gina, hindi tayo lahat, we cannot exist alone. We cannot just rely on ourselves and our own individual resources. We also need others. And we also should look at each other to see what the other needs, because you may be able to help that other person, and that by supporting each other, then we make it through this crisis. Okay. So no one was really prepared for this pandemic. I don't think we ever thought that this would happen. And it's worldwide. It affects everybody. It's deadly. You can die. So it affects all sectors, and any problems that have already been there before the pandemic became even worse during the pandemic. And we don't know when this will end. Para bang we hope, and then we get disappointed. We hope, we get disappointed. It's up and down. It's unpredictable. It's not within our control. That's why we're traumatized. Because we cannot, we all want to be in control, and we are not. We are just reacting most of the time. and you can be unemployed. Your whole family can be affected. So, puro lahat severe consequences. Hindi lang isa, no? Sa very many. So what did we do? No, actually, just like everybody else, we were not prepared at CPU. But as we've said, number one stress for everybody is during this pandemic is getting COVID as yourself or your family member or your coworker. So how do you then prevent people from getting COVID in the workplace? So we are fortunate that, of course, it takes funds, that we had UNICEF as a partner. And UNICEF also has its own disaster strategies, and we became part of that. So, so what was needed at that time and until now is PPEs, personal protective equipment for staff and also for patients. Because patients are also afraid to get COVID if they go to the hospital. And so when we look at the area itself, the waiting area of the patients, you could see here that the waiting area is now open because it has to be very well ventilated. And inside where it is closed, then you have exhaust fans in all the areas. And we have two areas. We have a COVID area and a non-COVID area. Okay, so that the two will not mix and people will not be afraid, because the level of PPE is different in the COVID area versus the non-COVID area. Then we need to have public health protocols like taking temperature of people, washing hands, having alcohol available, and you have to have spacing, social distancing. So you could see that the whole waiting area, iba na yung itsura, because when you go in, there is a limit to the number of people that you can have in a room. And of course, we should have the facility for RT-PCR testing for those who have symptoms, both the patient and the staff who may have symptoms. And when the vaccines came, because in the beginning wala pang bakuna, buti na lang nagkaroon ng bakuna ng mabilis, no? So that means everybody getting vaccination. But we still need the RT-PCR, and of course we don't want people paying for it. Even the patient, they cannot afford. So it's buti we have PGH as also as we are in PGH. So the prices of RT-PCR is cheaper, and then we also have funds to make it free for all, including patients. And as COVID went on, you learned other things like how important ventilation is. So next, we needed to have HEPA filters in closed areas and to measure the carbon dioxide in the area as reflection of how good ventilation is. So that means we had also partnership with Consuelo Alger Foundation to be able to get all of these additional equipment, again, to ensure safety of staff and patients. And we had the community who were generous. Yung community pantry, hindi lang yan sa community. Even the CPU were blessed with the community giving food so that all our patients are fed every day. Even the staff are being fed. As even the Israeli embassy gave food. People gave even clothes, slippers, bags toys to our patients. So every day, lahat na pumupunta sa CPU, meron silang regalo, meron silang pagkain, meron silang pamasahe, libre yung gamot, So there's really the generosity of the community really, warms our heart and everyone, and it helps, your mental health to have this so much support, overwhelming support. Nung nagkulang kami ng PPE, pati yung family court judges nag-donate ng PPE sa CPU, no? So whatever we need, magdadasal lang kami, prayer, and it's there. My belief in divine providence really increased 1,000 times, if not more, during this COVID pandemic. So work adaptations, of course, in the beginning, kahit transportation, wala. So how do we work out transportation among employees so they could get to work? We never closed, okay? And the schedule about decreasing the number of people within CPU to keep that, number so that hindi maghawaan. So we had to have creative ways so that people can work from home. And also we have different teams going on duty so that kung may exposure, pag mag-quarantine, isang team pwede ma-quarantine, then you have another team who can go on duty. And very strict on the public health protocol, no? Yung 4 dapat. In the beginning, we also saw a fall in the number of patients in all women and children protection units. I think we all knew that. And the reason, and for CPU, that reflected, you could see here, April, from March to April, our first lockdown, talagang bumagsak. Natatakot lahat, hindi pumupunta, hindi kumukonsulta. No? And then when the lockdowns eased, may transportation na, you could see that it slowly increased. But in the first year, hindi talaga yan bumalik back to the normal. So halos 1/2, no, sa CPU, yung annual number of patients talagang bumagsak to half in 2020. Pero we know that that drop in reports does not mean that there was a decreased incidence. We know that some WCPUs closed, or the people working in a WCPU were assigned in the COVID ward. Some social welfare offices, yung mga social workers, yung trabaho naging SAP, no? Hindi na nag-home visit. Schools were closed, so the teachers were also not in contact with the students. There was no transportation. People were afraid to go to the hospital they might get COVID. And the perpetrators were right there at home, and so hindi talaga maka-ask for help yung mga pasyente. So that's why we had to work with the hotline. So yung COVID hotline sa PGH, na-include na rin yung child abuse. And we know that hindi lang naman yung problema dito sa NCR, it's a problem in the whole country. So one of our projects was really to develop child helplines in each WCPU, no? So we were able to work with 60 out of the 114 that they will have their own child helpline for their area. And then because people found it hard, even the WCPUs found it hard to report what's happening. Before we know what's happening, we need to have the information. And how do you get that information if people cannot, are not, say they're working from home, etc. So that's why nag-develop ng web-based database that you can even use your cell phone to put in data, and that people working from home can also put in data just using their cell phone. So there's virtual access with CPN as the super admin, so that we have real-time data on what are the child abuse cases and and the number of people seeking help. We will have that data. And if you go to the website of CPN, www.childprotectionnetwork.org, every day you could see there the real-time reports of child abuse cases using this web-based database. And that means also, of course, the one adaptation everyone, I think, had to undergo is digitalization of services. How we can reach patients even if they're not there face-to-face. And so our psychiatric and psychologic therapy and counseling, for example, really needed to go telemedicine. No? So, but of course, you need access to the internet. No? And the social workers, because they cannot do home visits, naging digitalized na rin, video visit na or cell phone follow-up. But we know that not all patients have cell phones. So for the very high-risk patients, we loaned cell phones so that the social workers are in touch with them. Again, we did this in partnership with UNICEF. Case conference now is also via Zoom, no? So because people cannot meet face-to-face. And court hearings are also online. Actually, we like online court hearings because you can have court hearings in different areas, Manila or Cavite, all in the same day, but you are just there in the office, no? So you can do it. Even parenting, hindi na rin pwedeng face-to-face. So working with Ateneo, Oxford, and UNICEF, we started with the tip sheets, distributing the parenting tip sheets to our parents. And then the follow-up of this parenting is now done through tele, no? So tele-parenting. One problem that we have now, which is really worrisome, is that the suicide behavior is really increasing. Every day, we have the youth who are suicidal and who needs emergency treatment. We've never had this number of suicidal youth. That means abuse plus COVID, and all the stresses that come with that has led to this situation where suicide behavior is higher. So we needed to expand our mental health services. And again, we are grateful for our partnership with KNH so that we were able to expand our mental health services. And later on, together again with the telemedicine project with UNICEF, psychiatric services can also be availed of by WCPUs who do not have psychiatric health services. We know because of COVID that the whole ecology has been affected, the whole ecology of each individual. The fact that there is social isolation, that the people are so highly stressed with mental health problems, where the high unemployment is very high, where maybe regular services may not be available, and poverty is increasing with all of the unemployment or decrease in employment. So we know that all of these stresses is really adding up to the fact that abuse is also happening, or by itself can also cause abuse to happen. And so the cases that we see at CPU are more complex now, with higher suicidal risk, more concrete needs because of increased poverty and high unemployment. And if patients are not safe at home, it's very difficult to find alternate placement because of COVID. They need to have quarantine first or testing first. So there are other, so it's more complex. You cannot just find a shelter immediately. And patients also do not want to be admitted to the hospital. We have so many home against medical advice because they're afraid to be hospitalized or admitted. So that means that case management is more difficult now during COVID than it was before COVID. So that's why we really have high hopes that this project with UNICEF, wherein we are developing tele-CPU centers, right, to start with 55 barangays in 13 cities, where we now have as partners the VAUSI desk officers and members of the barangay, with the barangay equipped to deliver services with the use of also of telemedicine with us at PGH CPU. We will be able to expand the services that is face-to-face at CPU initially to follow-ups through telemedicine. So this is just one example of a partnership with the city. So there is a memorandum of agreement. We all have responsibilities. It is not just one way between the city and the PGH, Child Protection Unit, so that all the services of the social worker, the doctor, the psychologist, the psychiatrist, the police, okay, and lawyer consultation can be done through teleconsultation through the tele-CPU center sa barangay. Okay, in those 50, we started with 55 barangays. And together with this is the child helpline. Take note of the number 096873110032. So that this is not a rescue hotline. Okay, this is a helpline. The difference here is that you can ask what are the services, you can ask for your appointment, and for the urgent cases, then you can be given advice on what needs to be done at that moment in time. Okay, and you can also go to the barangay tele-CPU center. Okay, so this is my second to the last slide. This also meant that all our trainings are now online. And just to tell everyone that the 4 hours training for child abuse and neglect is fully asynchronous. So you can do it, you can finish it in a day with just the use of your cell phone. We have excellent feedback on this. We hope that everyone dealing with children do this 4 hours training on the online training. It's free. Okay, so, and for those who want to develop their multidisciplinary teams, this one you need to coordinate with us because it has both synchronous and asynchronous. And we want to fast track the development of women and children protection units. We still have 23 provinces without WCPUs. So now also for our target areas, please get in touch with us because the online training is ongoing. Okay, we also have to remember that the Philippines is number 3 in the world in terms of disasters. So COVID is not the only disaster that we are facing. This one is just a flood, the ordinary flood in Manila, you know, and this is happening all the time. But we have typhoons that are yet to come. And we have volcanoes that erupt. We have rivers that overflow and people drown. So we have to be prepared. Disaster preparedness and building resiliency is really now a critical skill and not just something that we are going to do just because of COVID. It's something that we have to continue on from now on if we're not yet doing it. Okay? So in terms of the number of patients at CPU, it's increasing. We're almost back to normal. And there are more complex cases, as I said. And that one thing that we really have to deal with is staff burnout. So this means having more resources to help staff and patients. I'm very happy with the lecture of Gina. We have learned so much from it. There are things there that we can use immediately, like the lusog isip and the katatagan. Everyone needs mental support in one way or another. And so we, as I said, this is a work in progress. There's still so much that we need to do. And we hope that we are, just like we have lessons learned, we continue to learn and do better. Okay, so this is together, we can stop violence against children. Thank you.
Maraming salamat, Doc Bernie. Thank you. Ang galing-galing naman ng CPU. Grabe, ang galing-galing. Ang pinaka main takeaway ko from your presentation, yung sinabi mo that building resiliency is something that we need to continue with or without COVID.
Yes.
Oo. And in a way, actually, isa ito dun sa mga, how should I say it, silver linings nitong pandemic ito. Kasi it really forced us to institute innovations, di ba? And review our protocols para mas maging matatag pa yung mga organizations natin.
Yes. In fact, the chair of our board, David Bradley, said that in this year of COVID, we have made more innovations than the last 20 years.
Talaga.
In a way, it's good.
In a way, di ba? Kasi
Yeah.
parang nagigipit ka kapag nagkakaroon ka ng problema, you're actually forced to find solutions.
Yes.
Ito yung mga
Yes.
problema na hindi natin nakita in the past, pero biglang, boom, pinakita sa atin lahat ngayon.
Mm-mm.
Oo. So merong tanong dito, I'm guessing this is from Facebook, sabi, Doktora Madrid, are the innovations in services, at least at CPU, going to continue beyond the pandemic?
Yes.
Sabi, this conference for one, it may be better online.
You know, going to this conference, the face-to-face, we had like maybe 2,000 also. We had a lot of registrants then in the face-to-face before, no?
Okay.
We reached already 2,000 something. But this one reached, because you can also even view the webinars even after the live. You know, you can go to the videos in Facebook and view it afterwards. So we reach easily 20,000. So yeah, so in that way, our reach is more because of this online webinar. And I even feel it's more interactive. Kasi you can interact with the chat box. You know, people can chat. Whereas before sa plenary, they were just listening pero hindi sila maka-react, no, immediately.
Ako, if I may suggest, blended.
Yes, yes.
Meaningful pa rin naman. I know that online reaches a lot more people, pero the discussions are always more meaningful kapag face-to-face. I mean, yung katabi mo lang, may matututuhan ka dun sa katabi mo. So, at least kami for GMA, ngayon nagbe-blended kami. Yes, we still go on field kasi mas meaningful pa rin siya, pero hindi namin pinapatay yung aming online infrastructure that we have put in place. So pwedeng mag-blended yung next Ako Para sa Bata, 'di ba? Na
sa 2022.
Diba, face to face pero merong online setup pa rin where other people can still join, yung mga hindi makakabiyahe papunta ng dun sa venue.
Yes, that's right. Kasi yeah, I think the next move will really be blended. We like the services, what we have now na naging tele, we will continue even post-COVID, no? Because we feel that it has so much potential in terms of reach, na pati yung mga GIDA areas, those geographically isolated and disadvantaged area, basta lang may internet, yun lang ang downside, no?
Which brings me to my next question. Paano yung walang access online?
Ganito yan. Actually, matagal na yan. There's a group of health professionals, no? Di ba may HPAC, Health Professionals Against COVID na group. And they have already worked with the government na through our Department of Technology, dapat magagamit na ng satellite para na may internet access yung mga GIDA areas, no? Na-approve na actually yun, pero ang specifics kung paano siya ma-operationalize, doon nagkakaproblema. But we can actually have access for GIDA areas through the government, satellite. So pag magawa na yan, di mas lalo ng grabe yung, connected na yung lahat.
Right.
Yeah.
So at this point, I'd like to call back in si Doktora Gina Hechanova Alampay. Ayan, hi Doc Gina. So, merong tanong dito si Evelyn Landingin. I think this is for Doktora Gina. How do you determine that a child has suicidal tendencies? I think si Doktora Bernie also mentioned this kanina eh.
Doc Bernie, ikaw na lang kasi ikaw yung pedia.
Oo.
Okay, Doc Bernie.
Okay. Alam nyo, for young children, they could have suicidal tendencies. Yeah, even very young children, pero hindi siya the same as adults in a way na walang ganang kumain or hindi natutulog. Pero but they can put themselves at risk for harm. You know, yung parang akala mo careless lang sa crossing the road, but actually gusto nilang masagasaan sila.
Oh my.
Oo. So mas mahirap mag-spot ng suicidal child, no? Kasi ang kanyang mga simptoma is not the same as adults, except that yung behavior niya put themselves at risk, or yung behavior niya ay sobra-sobra, no? Pwede ng ang self-harm is there. Pero yung mga teens parang adults na yon, no? So mas
Changes in behavior.
nagsa-start actually yung mga adult problems in mental health. Majority of them start when they are teens. You know, hindi lang yan that's usually na adult na sila saka lang lumalabas yung mental health problems. May idea ka na when they are in their teens, starting mga around 14 years old. Diyan na yan, actually diyan nagpipeak. You know, yung mga mental health problems sa mga teens around mga 14 years old. Diyan yan nagpipeak. And it's almost similar yung symptoms nila sa adults, no? Some may be cutting, you know, cutting, or some will already be yung all the behaviors that Gina described earlier, hindi natutulog or undereating or overeating, iba na yung behavior, na kumukulong sa room, ayaw lumabas. You know, ngayon during COVID, akala mo lang na you just interpret it na dun lang siya kasi wala naman siya ibang mapupuntahan. Pero baka mamaya hindi na yan because of COVID. Iba na, no?
Correct.
Yeah.
Pero Doc Gina, Doc Bernie, minsan din kasi lalo na yung mga medyo may edad na tapos hindi naman kumbaga hindi naman ganun pa kamulat pagdating sa mga mental health issues. May iba sinasabi parang baka nag-aarte-arte lang, baka ginagamit lang yung mental health as a reason para hindi mautusan, yung mga, alam mo yung mga ganon. So, how do you differentiate na talagang may problema na talaga ito, or basta kahit ano talagang kailangan tugunan kaagad natin?
Yeah, if you ask me, I would rather err on the conservative side.
Yes, okay.
In that starting with just talking to the teen or the child in the way that Gina described earlier, you know, that can also be done to the child.
Kumusta ka? Ganyan.
Oo, yung kamusta ka. Importante talaga yung kamusta ka. And if you really have, especially mothers, meron yan silang second sense, gut sense sa mga anak nila that something is just not right. Yung nanay ko noon, tingnan niya lang yung mata niya, alam niya na when I'm feeling good or bad eh. Alam niya talaga, I know when I look into your eyes, she tells me, when something is wrong. You cannot tell me otherwise. So for me, dapat tanggal na natin yung stigma sa ating consultation na sabihin sira ulo mo. Hindi na yan. Actually, there's a very good source ngayon. Everyone, if you can just download it for free sa internet. Yung UNICEF State of the World's Children Now, 2021. Yung kanyang focus is mental health of the child.
Right.
And it's developmentally described. Ang ganda na resource na yon. Please, you know, read it. You would love it because it tells you that when you talk about mental well-being, it's always you know, it's a range. You know, so sometimes you feel good, sometimes you feel bad, and that we should not tell a person that she is abnormal. You know, because that really, you know, in that range, people travel back and forth. And that what we want is that at the time when they need help, they get it, so that they don't dwell very long in that range where, you know, their well-being is low, you know. So that's why I said tanggal yung stigma. it's not about being crazy, you know, and that everybody has highs and lows, but you will need help, but it doesn't mean that you're weak. You know, kasi yan yung ano ng lahat eh, kasi you're telling me na hindi ko kaya, you know.
Okay, speaking of everybody having their highs and lows, sabi ni Jam Palpalato, tungkol naman sa staff burnout. Doc Gina, ayan, ikaw sasagot nito ha. Is there a tool? Is there a tool to assess if the staff is really burned out?
Yeah.
And when should we check? Baka naman tinatamad lang. Joke.
So there are a number of tools. Ang familiar ako is called the Maslach Burnout Inventory. Tapos ang tinitingnan niya 3 bagay. So one is the feeling of exhaustion. So parang alam mo yung pakiramdam mo minsan na upos ka na. Yung parang walang-wala ka na mabigay. Sobrang pagod ka na, hindi ka na makaisip. Yun, yung parang that sort of emotional exhaustion. Sometimes it can also be na parang wala ka na ring, ano ba, especially for helpers in the helping profession, parang wala ka ng empatya. And we see this a lot, di ba, Doc Bernie, in healthcare.
Yes,
medyo ano na sila, wala na sila.
Parang routine na lang.
Wala ka ng feelings.
Oo. Parang wala ka na. Kasi wala ka na mabigay wala na eh. And then the other might be, lalo na again, in a helping profession where you, di ba, generally we're doing this because we love the work. Pero yung, when you stop loving it na, yung parang, you're dreading going to work already, ganon. So medyo yun yung mga tinitingnan natin, na pag ganon, medyo parang yun yung signs of burnout, no? Parang yung feeling mo na upos ka na, yung wala ka ng empatya, tapos hindi mo na gusto, or parang wala ka ng pagmamahal, or you don't feel any sense.
So kumbaga parang functional ka pa rin naman, ginagawa.
Yeah.
Pero you're just going through the motions of it. Parang wala ng extra oomph dun sa ginagawa mong trabaho na dati naman nandoon.
At saka parati kang naiinis.
Ay!
Oo, nainis ka na lang sa lahat. Iinis ka sa lahat. Everything just irritates you.
Everything just irritates you. Okay. Ito naman, may tanong si Jasmine Faith Enriquez. Okay. Paano naman daw yung mga hyper-independent people? Ano kaya ibig sabihin ng hyper-independent? Yung parang hindi ko kailangan ng tulong. Yung ganyan. Paano naman daw yung ganon? Meron bang ganon?
Meron actually. Ano naman?
Ganon ako dati. Parang feeling ko weakness, sign of weakness pag humingi ako ng tulong. Pero ngayon humingi na ako.
Diba? It's, to some extent, some of it might be cultural. Kasi malakas yung shame at hiya natin na ayaw natin na pinapakita. Tapos mas malakas siya sa lalaki, ha? Medyo mas malakas yung sense na ayaw. Di ba ayaw nga magtanong ng direksyon?
Correct!
Medyo may
hindi ba nagtatanong ng direksyon?
Oo, yan. So parang cannot show vulnerability. Parang normal naman yun. Pero when it's detrimental na, for example, you see the person struggling, pero ayaw pa rin humingi ng tulong, that's where having peers and colleagues or even bosses na sundot, di ba? Na parang, I see you're struggling, or even without saying that you're struggling, tulong lang. Parang just offer. So sometimes it's just to break through that barrier of hiya or shame. And then again, parang the messaging, especially if you're leading people, should always be, it's okay. Yeah, it's okay to ask for help. Parang kailangan meron kang communication na, it's okay to say you're struggling, it's okay to ask for help. Kami ngayon sa campaign namin in drug abuse, ang ano namin is hindi nakakahiya humingi ng tulong.
Correct. Hindi nakakahiyang humingi ng tulong. Alright. Paano naman daw yung mga tao na siguro mababa yung self-esteem niya. Ito yung tanong ni Leanne Rose Aragon. Sabi niya, any advice for someone na nagagawa naman niya yung kailangan niyang gawin, pero at the end of the day, hindi pa rin niya ma-feel yung happiness or satisfaction. Or hindi pa rin niya alam kasi yung gusto niya talaga. Or, I don't.
Yeah. It's funny kasi parang right now, I'm just looking at the study of one of my students. And parang dun sa study niya, tinignan niya yung different facets of job characteristics and what enables meaningful work. And in the Philippines, ang lumabas, feedback. Yung pinaka-strongest predictor of finding meaning in work. So feedback about how I'm doing, whether it's from my clients or my boss or my peers. And when we're looking at that, it might be, again, it's the social identity of Filipinos na parang we're not just by ourselves, but we validate who we are as a product of what my peers say about me.
Okay.
And it's not something that sometimes, kasi nagtrabaho ako sa States, tapos napansin ko, culturally, parang iba yung kultura, no? Parang doon, they're more effusive with praise. They're more, wow, great job. Parang hindi tayo kasing
Ganon.
positive. Hindi tayo kasing effusive. And I'm thinking, maybe we need to be a little bit more expressive, especially bosses, no? About, saying na good job or you did well. I'm not sure why we're not as effusive as a culture about praising other people. But
Pero
maybe,
importante yun no? Yung kahit na maliit na bagay, parang i-praise mo. Kasi who knows, baka yung maliit na parang, uy, good job, or yung isang maliit na thumbs up, will really help the self-esteem of that person. 'Di ba? Ako nga minsan ito tinuro lang to sa akin ng asawa ko. Sabi niya, mahal, pag pinapagalitan mo yung researcher mo, medyo sundutan mo ng konti. Pero, hard worker ka ha, hindi mo lang nakuha ngayon, pero alam ko bukas makukuha mo yan. Parang sundutan mo ng konting ganon, para lang daw hindi masyadong mawalan ng pag-asa.
Oo, meron kami tinuturo na sandwich approach.
Sandwich approach. Okay, sige.
So, una, i-affirm mo yung effort, di ba? So, alam ko, pinaghirapan mo to. Pero, ang daming typo error, ang daming, Tapos, sa sandwich mo, pero alam mo, tingin ko, kaya mo pagbutihin pa to Di ba? So, parang binigay mo pa rin yung feedback, pero sinandwich mo siya na affirm na, okay, nag-effort ka, tsaka alam ko kaya mo pang pagbutihin. So, meron din paraan. Para hindi masyadong masakit, kasi masyado tayong personalistic minsan.
Correct.
Pag medyo konting criticism, akala mo niyuyurakan mo na yung pagkatao. So,
Doc Bernie, may tanong si Teresa Gomez. Sabi niya, nagkaroon na ba ng insidente in the past na may inassess kayong bata na kailangan talaga ng treatment pero yung mismong mga magulang ang nagre-refuse?
Oh, yes! Oo. Marami, hindi lang isang beses.
Okay.
That's really the most difficult case, no? So that's why it really takes a team. Kasi sa ganyang klaseng mga kaso, we have a whole team, no? The doctor, the social worker, the psychologist or psychiatrist, even the police, the lawyer, because there are many things that you could go through para na matulungan yung bata kung ayaw ng mga magulang. No? So how do you do it? Is there a safety issue? So it's not unusual na you will have that. So how to deal with that takes a lot of training. No, I cannot discuss the whole process here, but just to say that that's common.
Oy, nag-a-ask daw ng extension ng audience. Payag daw ba kayo? Gutom na ba kayong dalawa?
Wala akong problema.
Kwentuhan ba?
Sila lang yung nag-aalala lang ako sa kanila, baka kung gutom na sila, magiging hungry sila. Alam niyo ba yung hungry?
Hungry!
H-A-N-G-R-Y.
Stress yan. Kasama sa self-care yan. On time.
Okay. Anyway.
Pwede naman kahit konti.
Okay,
Oo.
okay. Let's move on pa. Maraming mga nagtatanong tungkol sa suicidal thoughts. Sabi ni Jameson Patindaw Jose, sabi niya, ano daw yung possible na triggers ng pagkakaroon ng suicidal thoughts in children and adults? And as parents or as experts, anong pwede natin gawin para hindi na sila umabot dun sa mga thoughts na ganito?
Ang hirap naman ang tanong na to.
Kasi
Pero
marami,
oo.
iba-iba.
Iba-iba, pero usually, yung suicidal thoughts, hindi naman yan nanggagaling out of nowhere eh, di ba? Doc Bernie. So usually, it might be a manifestation or symptom of depression, right? Na parang dumating na dun sa point, pero undiagnosed.
Mm-mm.
Kaya importante din na, yun nga, yung parang the educating the parents. Kasi yun nga, tama ka kanina, parang sabi, di ba, there are parents na, nag-iinarte lang yan. Or,
Yes.
di ba, parang lakasan mo lang yung loob mo. And many times, hindi nadadiagnose yung conditions because hindi in-acknowledge ng person that the anxiety or depression is real. So,
Yeah. Yung what we have to learn is that, and this is usually anong tinuturo ng trauma-informed care, is that when you see a behavior na hindi ka nais-nais sa isang bata, and it could be, suicidal behavior or some bad delinquent behavior, it's because something happened to them. It is not something because it's not innate. It's most of the time really something happened to them. It could be na hindi naman kaagad-agad, kuminsan para siyang delayed reaction. Could be the trauma could have been even a year or more ago, at saka ngayon lang truly nagmamanifest outside. Pero there's one book na I would recommend for everybody, na if you could get it, the body knows. The body knows. Kasi lahat na na-experience mo, na-absorb ng body mo at na-affect yung body mo. So every experience that you have is recorded by your body. And it can come out as a physical symptom or poor health, physical health, or it can come out as poor mental health. Yeah.
So siguro ang lesson dito is not, kasi iba-iba po talaga yung triggers, Marvin, and dun sa nagtanong sa atin, iba-iba yung triggers talaga. Pero ang pinaka-importante dito is for us to be more sensitive. Huwag nating baliwalain lang na nag-iinarte lang yan, ganyan lang yan. Kapag may nakita ka na kayong change doon sa behavior ng bata, maybe there's something wrong, and baka kailangan lang muna ng kausap, di ba?
Yeah.
Yung ganon. And kapag hindi na kaya sa level ng pagkausap, consult an expert.
Yes.
Oo. That's also related to the question of Arnel Prenosilio. Sabi niya, what is the first approach when you notice that your child has suicidal tendencies? Yun. Kausapin.
I think tama naman, oo. Tama naman yung sinabi mo, Cara. And sometimes the suicidal tendencies may not be overt behaviors. But for example, it might come out in their writings, in their drawings. Kaya kami as teachers, minsan doon namin nakikita, may sinamit yung estudyante na medyo very dark or, so minsan ganon. Minsan,
hindi obvious.
Hindi necessarily obvious, but if you pay attention to the child, di ba? If you pay attention to what they write or what they draw, or sometimes just their body, kasi minsan self-harm, they cut, di ba? Minsan may parang trajectory siya. So minsan it starts with self-harm. So you actually also want to pay attention to their body. If you see signs na they're cutting or they're harming themselves, those are red flags na they're feeling some things but they don't know how to regulate their emotion. So they try to harm themselves in trying to, forget the pain or diffuse whatever they're feeling. So,
sabi nga ni Edna Estal from our chat box, we need to spend more time with our children as much as possible. Be sensitive and be more responsive, sabi naman ni Bienvenida Villofesente. Ayan. Meron din bang effect yung exposure nila too much on social media? Hindi ko alam kung totoo to, pero minsan may nababasa ako na parang baka ginagaya nila
Yeah.
yung nakikita nila sa social media.
Yes. They do. Di ba meron mga suicide groups?
Oo.
And they get influenced by that. And those who already have beginning problems.
Oo.
And then remember yung whistleblower Frances Haugen, sinabi niya what the Facebook researchers have found out na those with that just by Instagram exposure to Instagram as high as like 25% of teens become depressed. Looking at comparing themselves, to the perfect bodies na ano naman hindi naman totoo. But they compare themselves there, and then they become depressed, and so yes, social media has a lot of influence in terms of how you feel about yourself, and it could cause depression and anxiety.
Lastly, si Marvin Garcia, sabi niya, can you give some practical ways or tips on how to cope when someone is experiencing an existential crisis? Ano kaya yung existential crisis? Yung parang ayaw buhay, ganyan. Pero siguro, ano na lang yung practical tips? Kasi we've been talking about yung parents, as parents sa ating mga anak. Pero kung ikaw mismo yung nakakaramdam ng you feel that you're not okay, meron bang mga tips to be okay? What can you do? Aside from seeking a psychiatrist, obviously.
Okay. So self-help?
Gawin.
Oo. So marami naman kasing self-help tools that we can try out. And it doesn't necessarily always have to be a mental health professional, but reaching out to people is important, diba? Whether that's a friend or a parent or a teacher or just somebody that you can trust is important. And it's also important kasi bata, di ba, ihawak natin. So even para sa akin from a psych perspective, ang existential crisis and even all, parang that's partly part of growing up, di ba? Parang identifying who you are, what your sexuality is, what you want to do. It's sometimes for others, it's a longer process na meron niya kilala, mag-graduate na, hindi pa rin alam kung anong gustong gawin. 40 years old na, meron pa rin hindi alam kung anong gusto gawin. So, for some, it's a long process. There's no quick and easy answer. But I think the important part there is them reaching out to talk to people. So, for example, nagkaanak ako na nagka-faith crisis, gender crisis. So, tinanong ko, do you want to talk to a religious person? So, do you want to talk to a gender counselor? Ako as my role as a parent is kung hindi ko kasi alam answer sa lahat, at least hahanap ako ng pwede niyang kausapin, di ba? Find the right person to talk to.
So at the end of the day, it's really the social interaction na importante. Na kailangan, katulad nung sinabi ni Doc Bernie kanina, yung resilience is a product of yung tulong na natatanggap natin at support na natatanggap natin from our peers, from our family, from our friends, even from our clients. Kaya sobrang importante ang role ng organizations, ng workplace natin, kasi kailangan yung social interaction na yun. It can help save one's life. All right. Before I ask you for your final message, ito may clarification lang si Leia Quijada kasi you talked about gender kanina. A child who wants to be a lesbian or a gay, is that part of depression?
Ako, I don't believe that it's a choice that you want to be. I just believe that you are. But
Yeah.
it's just the acceptance that you are that's difficult.
Oo.
I'm sure I'll get a lot of criticism, especially from the conservatives here. But that's what we believe. No? It's not necessarily. I believe it's not a choice. That
Oo.
you just are.
And I don't think it's a psychological problem.
It's
Yes.
not.
Wala
Oo.
na po sa DSM ang yes.
At hindi rin po natin trabaho yung i-impose doon sa ating mga anak kung ano ang dapat na maging gender nila. Di ba?
Yes. In fact,
natin kung saan sila masaya.
yes. In fact, many times the mental health issue is because they feel that they cannot be themselves or they will not be
Yeah.
accepted. It's not so much for the preference or the identity, but it's the lack of support
Yeah.
from
Di ba there's one study among teens? The number one cause of depression was because their parents could not accept their gender.
Yeah.
Oh, okay. So it's not part of depression. It might cause depression if you don't accept your child's preferred gender. Anyway,
yeah.
oo, ang dami pa nating mga tanong pero magla-lunch na tayo. So before we end our panel discussion, I would just like to ask Doc Gina and Doc Bernie for your final message to our participants on how to be resilient. Paano nga ba natin, how to keep sane, how to keep going, how to be matatag and malusog ang ating isipan kahit na ang dami-daming problemang kinakaharap ngayon ng ating pamilya, ng ating bansa. Doc Gina, you wanna go ahead?
Sige. So, una mag-umpisa ako dun sa it's okay not to be okay. And the first part of acknowledging it is acknowledging that we have to acknowledge that we have feels. And,
Yes.
there's no right and wrong. So that's the first part. And then there are many self-help. Yun nga. So you can try the Lusog Isip app, but there are many other self-help tools that you can try. But again, there's no shame. Hindi po nakakahiya humingi ng tulong at maghanap tayo ng pwedeng kausap. Hindi kailangan mental health professional kaagad. There are hotlines, helplines that we can use as well. So sa akin, social support is very important, but it's also the right social support. Kasi pwedeng social support pero pare-pareho kayong galit at paglabas ng usapan nyo, lalo kayong galit, di ba? So it's also getting the right social support. As adults, I also believe that our children will be okay when we first are okay, di ba? Kasi we need to model being okay, and we need to help our children be okay. But that begins with us. Thank you.
Thank you, Dr. Gina Hechanova Alampay. Thank you. Doc Bernie.
Yeah. I'm going to be corny. But I'll tell you, this is the truth on how I survive. Wala pang di, no? Kasi it's still continuing. How I survived this pandemic. Number one, really, I think I became more spiritual. I prayed more during this pandemic than any time in my life.
Yeah.
So I think that prayers really work, and that no matter what your religion is, that you should pray deeply, sincerely, talk to your God every day. Number one. Number two is you should have something to look forward to every day.
Correct.
You cannot have a day where you don't look forward to something. There must be something that you like doing, even if it's just reading your favorite book or doing. You should have something that you look forward to because you're excited to do it. Kailangan meron kang ganun. And then, well, it might not be that immediately that day, but basta you're looking forward to doing something. And then number three is that you work on something.
Yes.
So whether it is to exercise or may hobby ka na, whether it's painting or whether it is crochet, or whatever it is, but you're working something on yourself to improve yourself on something. So it's not, well, it could be work if you like your work, Basta, you're improving something. So those are the three things.
Thank you. Thanks, Doc Bernie. Ako dadagdagan ko lang yon. Find something to be thankful for every day. Ako, yun ang akin. Kahit gaano kaliit, kahit na, uy, marunong nang umupo yung aso ko. Uy, marunong. Uy, hindi siya umihi sa, ano ngayon, sa kwarto namin. Find something to be thankful for.
Yeah.
Thankful for. Yung mga ganitong lecture series, ako, I'm thankful for this kasi madalas lagi nating iniisip that the COVID pandemic is a big, big problem lamang. Pero I'd like to view it not only as a problem, pero as an opportunity to rise above adversities. Bawat trahedya pinapatatag tayo. At kung may isang bagay akong natutuhan sa pandemic na ito, ipinakita nito sa akin yung mga bagay na pinakamahalaga. Pamilya, kaibigan, pagmamalasakit sa ating kapwa. At ipinakita nito sa akin na gaano man tayo kalayo sa isa't isa, hindi tayo nag-iisa. And sa kabila ng lahat, marami pa ring bagay ang dapat ipagpasalamat. And with that, maraming salamat, Dr. Bernie Madrid, Dr. Gina Hechanova Alampay. I now turn you over to Dr. Stella, who has the difficult job of synthesizing. That's what I'm thankful for. Hindi ako mag-synthesize nitong napaka-fruitful na discussion natin ngayong umaga. Doc Stella!
I don't think I have to summarize. I'd like to thank Cara for this wonderful moderating job. Talagang iba talaga ang professional and seasoned host. Bigyan natin ng palakpak. Virtual palakpak si Cara. Maraming nga it's very engaging and 12 noon na, lampas na, 990 plus pa ang nasa Zoom. So this, Cara, thank you very much. Iba talaga yung itong hosting mo. And I think you really summarized
lecture.
Yes, and I'd like to thank Dr. Alampay and Dr. Bernie Madrid. Ang galing-galing niyo talaga. And people were really so engaged. So ano pa bang isa-summarize ko? Pero talaga, I think the message that stays with me is that it's a shared experience, this pandemic, and we also, being resilient is also something shared. In other words, we cannot recover alone. So Dr. Bernie showed us na marami namang ginawa talaga CPU that we did right. And palakpak for CPU. But there's more that has to be done, okay? So while mental health support was made available, not everyone availed of it or were hesitant to access it. So maybe we should focus on mental health wellness. And Dr. Gina showed us the apps, Lusog Isip, that we can use to assess whether we are really all right. Because maybe even if we think we are okay, we are not. So the Katadagan model naman shared by Dr. Gina, mukhang it's a good resource. And we can access this to maintain mental wellness and resiliency. Finally, last words, the pandemic has reshaped our behavior over 19 months. Imagine 19 months na. And it will really take more time to recover from this global trauma. But Dr. Bernie reminded us we should be ready for other disasters. Don't you agree? And the silver lining in this pandemic is that we are better prepared now because of the lessons learned from this COVID pandemic. So back to you, Cara.
Maraming salamat, Dr. Stella Manalo. Thank you very much for that wonderful synthesis. Thank you, Dr. Gina Hechanova Alampay and Dr. Bernadette Bernie Madrid. To our very active participants, maraming salamat din po sa inyong mga tanong at sa inyong mga comments. Muli, maraming salamat po sa inyong lahat. At sabay-sabay po nating sabihin na ako, tayo, para sa bata. See you again and stay safe. Ako po si Cara David. Ingat po palagi!
Sit, sit.